Hi, Dr. Saxena here, and I was talking about what are the chemicals, what are the things which we are directly influencing our health problems. Basically, I just wanted to tell about something which is our the subject is like our products are our enemy. Yes, I just want to talk on this particular thing, including bottled water, metal cans, nail polish, plastic wrap. See, there are so many things which are we keep on using on day-to-day basis, and is this one thing called endocrine disruptors. These are ones which are called as endocrine disruptors, which interfere with the endocrine system. When I'm talking about interfering with the endocrine system, they are able to prevent the action of normal hormones and alter the concentrations of natural hormones. So, what we are getting in thing as a result of that is problems like diabetes, infertility, cancers, and so on. This is a big kind of thing which is happening over a period of time, and we need to look at what is this endocrine disrupting chemicals disrupting the health. It is disrupting children's health, it is disrupting adults health, and I just want to talk about focus on two things which are called phthalates as well as bisphenol A. This is a purely a kind of series which I believe that I need to educate people. Unless we educate the people, we are not going to seriously see the because what happens is that with this chalta hai attitude, we people I still see in my clinic, in spite of creating all that trying to tell everyone not to carry their plastic water bottles and bags and all that, people are still into that particular thing, and unless we change ourselves, I don't think we can only change by just understanding where are we heading. These endocrine disruptors are basically big things, and I can always tell about some endocrine disruptors which include pesticides, which is DDT and DDE. You have got organohalogens, which is called PCBs and dioxins. We have mercury in heavy metals, major kind of stuff, and we have plastics and plasticizers. So this particular thing, what is happening is right from the pregnancy, from birth, infancy, childhood to adulthood, everyone is affected. It is risk factors throughout the lifespan. We used to tell that what the risk factors for diabetes is a risk factor. For diabetes, what is the risk factor is your this bisphenol and this endocrine disruptors. So I want this take home. You should understand what is the root cause of the disease. I have been always talking about root cause. Why should diabetes have uh, proliferated so much? What is the reason? You need to look at all this stuff. So unless you understand what is this, see, what I'm talking is plastics are everywhere, and phthalates are anti-androgenic, as well as bisphenol A is a weakly estrogen. Apart from that, bisphenol A is directly responsible for this insulin resistance causing the type 2 diabetes. So plastics are everywhere. Even the baby shampoo study raises chemical concerns. You have phthalates found in the urine of infants after they were powdered or lotioned. So even we understand about the baby bottle danger. When we talk about the baby bottle danger, I want you to understand this particular thing. Because what a bisphenol free nipples, bisphenol free products, it should be the order of the day. And this is one thing for the baby, it could be really poison. It may be very good smell for the pregnant women, but for baby, there is a big no, not too pretty.org describes this particular stuff. And what that contains is a lot of phthalates, and this is one thing which I want everyone you should understand. You should ask, in fact, that if your child toys has contained some phthalates, or your child's bottles with bisphenol A, they contain bisphenol A or not. And so what are you looking for? What are the alternatives? I can always go on and on here. Phthalates are found in almost every baby products, including right from your toys to your shampoos, cleansers, all those things. And apart from that, you have got sometimes you inordinately try to take plastics as important in a healthy diet. All these wraps which are available, and all these things which go into deep freeze. And apart from that, you have got there is a thawing which happens because these contents are all engrossed in that particular thing, and they leach out something like bisphenols. So this is an important thing, and I just want you to understand by this table with this other food product, whether what is the kind of things which you are having phthalate, and what phthalate after metabolites what they get into that. And probably this is a big thing which all of we felt we were not informed about this particular stuff, because what happens that the end products which we get, they are really toxic and causes a lot of problems. Similarly, you have got something like PVC, which is polyvinyl chloride, and other cosmetics like, and nail polish. Nail polish is one thing I just want to. There is a thing called DEP in that, and I somewhere I try to tell most of my patients, yeah, if they are wearing the nail polish, I tell them, okay, this is one you have come to a doctor which you will not like to come again, because even to remove that nail polish, you have to use some solvents, which is acetone, which is as bad and probably more than 100% more toxic than alcohol. So this is one thing which we to be properly shown. Unless people are ready about this, they can always understand this. So all these things, this thing which we had been isolated from children to 20 years old, this was isolated in urine, and this was the animal. There were some findings of phthalates. Findings, animal studies demonstrated that the male reproductive system is particularly sensitive to this anti-androgenic effects of phthalates, and it's a big concern, and the summary of findings are really bothering. There are adverse birth outcomes because of this, and reproductive toxicity is there, and in humans there are alterations in the hormone levels. There are something like male infertility, you have got asthma, puberty, and body size. These are the areas of concern. So there needs to be a proper this one, and we call it this as a phthalate syndrome, where there is an anti-androgen effects which happen. The child, male child, will develop something like hypospadias or undescended testes, fetal germ cell. And as a radiologist, I remember checking the undescended testes, and he used to locate in the inguinal canal or something, and the surgeon tries to put this down into the scrotum, and it was a big surgery. But I now understand this is something like a phthalate syndrome, and this is really was a eye opener for us, because the women who were using all this fragrances and all that, their shades were more likely to get affected with this particular conditions. And yes, I just wanted to show you this was basically, we tried working with a group of doctors. I tried to show them this is what is you mean by anogenital distance, and it gets shortened when you have got this particular thing. So anti-androgenic exposure causes, because of this phthalates, results in decreased anogenital distance. And this is one of the papers which was presented in environmental health perspective, and we are just trying to rather accumulate all these things. And there is another paper of this particular stuff, phthalates and testicular descent, and it is again this phthalate is acting as an anti-androgenic stuff, and this is the kind of study which appeared in 2005. Uh, Postnatal exposures like phthalates in the breast, that all these things were prenatal exposure. The mother was using fragrances, or it can be a mother consumption of dairy and all that. So, postnatal exposure is phthalates in breast milk and serum hormone levels. What happens here is postnatal exposure, phthalates in the breast milk, and serum hormone levels in male offspring. You get something like elevated LH levels, decreased free testosterone, and elevated. So this is what we are seeing presently as a epidemic. I see a lot of kids who look very chubby, and they are like they're so fertile in the sense they're this particular stuff because probably because of this phthalates and all that. And this was the study which showed what is the exposure of phthalates in infants because of powder, shampoo, or lotion. And again was in a pediatrics journal, and there are these things are really we have to look at some of the kind of legislation or something like that, because already this Consumer Product Safety Improvement Act of 2018 USA has there's a mandatory third party safety testing for all toys and products marketed to children below 12 years old. There is a legislation, and this sort of thing has to come here as well. It includes ban on phthalates in toys and children's products. These things should be totally out. There should be interim ban on the use of other phthalates as well. Even the European Union has banned DHP, DBP, and BBP in cosmetics due to their potentially carcinogenic, mutagenic, and reproductive toxicants. There are, I can't go on and on, but I just want to tell you is that you need to follow all these things, and what are the areas which I would be suggesting where you can always what you do to reduce the phthalates exposure. You can always look into precautionary approach. One is eat fresh fruits, avoid the use of microwave, avoid use of dishwasher, wet mop and dust frequently. You see that you seek phthalates and free labels, and these are the things which have been already discussed by a group called cosmeticsdatabase.org. And always look into something like recycling labels. Number 3, in plastic, on the back of the bottle you see the numbers. You need to be careful about that numbers. If it is 3, it has got phthalates in that. And plastics, one more thing, simple thing about that, the front of the card you should always look at 1, 2, 4 and 5 are stable, this safer plastics. And you have got whereas you have got 3, 5 and 7 are the plastics to avoid. Plastics to you should not look into that particular thing. So what are the areas which we are looking? Bisphenols is there in all the cans, and this one, because the internal lining of this is all these products, baby bottles and all that. And last but not least, you have got something like thermal paper. You swipe a card or something like that, you get that paper, and you just keep that. That has got phthalates. And anytime you use the card, swiping card, this is phthalates as well as. We have some dental sealants which have got phthalates. You need to be careful about that. Exposure is quite widespread according to the whatever studies which were done. Bisphenol is present in about 93% of the population in US, and it is something which is really we are finding more and more things in here also. To summarize, I can always tell you this particular stuff like bisphenol is a animal studies, which bisphenol is it causes adverse birth outcomes. Human studies shows prenatal exposure and neurodevelopmental problems. You have got prenatal exposure and wheeze in children. You have got cardiovascular disease, type 2 diabetes, and obesity resulting because of this phthalates and bisphenol A. You have altered liver function, which is alteration in GGT, gamma glutamyl transferase, LDH, and alkaline phosphatase. And this is one thing which I certainly tell everyone to be careful, because I had seen the things which I had seen something of this BPA in dental sealants from dental reasons, from enzymes. It is detected in 3 hours or up to 3 hours, and this particular thing, um, I somewhere this is a very common area, which is usually geriatric people. They keep their dentures and all that. It leaches a lot of bisphenol, and it really causes a big issue. So what can be done now is to go like this. You need to get into a BPA free zone, and yes, it's going to be costly, but I think we need to do this. We have to look into some of the things. um, we need to educate people. We are trying to tell them, okay, you have got something like bisphenol free bottles are available for the kids, and you have got stainless steel water bottles which has to be used. You don't have to really look, and you choose alternatives to canned you look for fresh fruits instead of, and consider select glass containers and all, and this should be the major kind of thing which helps in a big way. um, Thank you.